Are you experiencing difficulties getting pregnant? Are you lactating even though you have not been recently pregnant? Is your menstrual cycle irregular? Do you have excessive facial, chest, or body hair? Is your hairline receding? Do you have acne that wouldn't go away? Are you finding it difficult to lose weight? Doctors say that if you answer yes to 2 or more of these symptoms, you might have Polycystic Ovary Syndrome, known as PCOS. I recommend that you make an appointment to see a doctor for professional diagnosis today. Hi everyone, and welcome back to Sisters Keeper. I'm Anu. What is PCOS? PCOS is a condition where a woman has multiple cysts on her ovaries and a hormonal imbalance such that she has higher levels of male hormones than female hormones. PCOS is one of the most common causes of female infertility, but it's a lot much more than that. It's a lifelong health condition that continues far beyond the childbearing years. People with PCOS are often insulin resistant, increasing their risk for type 2 diabetes. According to healthline.com, in an article on the effects of a healthy diet on PCOS, dated December 22nd, 2021, when symptoms of PCOS are not managed, women with PCOS may also be at a greater risk of heart disease, endometrial cancer, diabetes, high blood pressure, sleep apnea, strokes, depression, and anxiety. It's common for women to find out they have PCOS when they have trouble getting pregnant, but it often begins soon after the first menstrual period, as young as age 11 or 12. It can also develop in the 20s or 30s. The problem with PCOS diagnosis is that even though these symptoms are apparent, they are often dismissed as being due to some infection or the other. The over-reliance on the same herbal mixture as the panacea for anything from, wait for it, infertility to a toothache doesn't make early diagnosis any easier. Another reason for late diagnosis could be the fact that some women think that the lengthening of their menstrual cycle is due to a hormonal imbalance, which will eventually self-regulate. A hormonal imbalance needs to be diagnosed at a hospital after blood work to analyze your hormone profile. What causes PCOS? The exact causes aren't known at this time, but having male hormone levels that are higher than normal and/or having a mother or a sister who has PCOS are contributory causes. Being overweight is also associated with PCOS, even though many women of normal weight have PCOS and many overweight women don't. As we can clearly see, our village people, the confirmed neighborhood witch, and the evil spirits are not the culprits here. If you have PCOS, you may feel embarrassed and frustrated at times. Eating a PCOS-friendly diet and making some lifestyle changes may help improve your mood and reduce some of the associated symptoms of PCOS. Foods to add to your diet are high fiber and other vegetables like broccoli, lettuce, spinach, green and red peppers, beans, and lentils. Some other healthy additions to the menu are fish, especially tuna and mackerel, turmeric, tomatoes, almonds, sweet potatoes, tofu, soy products, olive oil, and foods made with wheat flour in place of white flour. Foods to limit are foods high in refined carbohydrates, basically anything made with white flour like white bread and muffins, sugary snacks and sugary desserts. Processed meats like sausages and corned beef, also red meats, fries, and margarine also need to be taken off the meal plan. On a PCOS diet, you may also want to reduce consumption of beverages like soda and juice, which can be high in sugar. Other lifestyle changes to consider with PCOS include exercise and daily physical movement. According to the CDC, in an article on PCOS and diabetes last reviewed On March 4th, 2020, exercise and a healthy PCOS diet can help reduce insulin resistance. Many experts agree that at least 150 minutes per week of exercise is ideal. The symptoms associated with PCOS can cause significant stress. Speaking with a therapist or another healthcare professional may be beneficial. What are your own experiences or thoughts on PCOS? Please let me know in the comments below. And that wraps up our time together today. There's something new coming next. Subscribe to ensure you don't miss it. Thank you for listening. Remember to be your sister's keeper. If you found this video useful, please subscribe, share and like, and then leave a comment in the comment section below. Contact us via our socials at sisterskeeper42 and email sisterskeeper42@gmail.com. Take good care of yourself, and I look forward to talking to you soon.